Hello, friends. Welcome to the Veterinary Life Coach podcast. Today, I have a wonderful return guest for you. Her name is Dr. Shannon Bass, and she is the Vice President of Medical Leadership at Vets Pets and the President of the North Carolina Veterinary Medical Association. And she is an emergency medicine veterinarian for 17 years. And we did another podcast together not too long ago. And I promised that I would bring her back to talk about moral injury. So that's what we're here today to talk about. So welcome to the podcast, Shannon.
Thank you. I'm really looking forward to talking about this.
Yeah, I'm delighted to have you back. So we're going to talk about moral injury. So why don't you start by just telling us what that means? Like, what's that definition?
Moral injury was initially defined by a human psychiatrist. I mean, he's obviously a human. I actually become aware that people outside of veterinary medicine don't specify doctors as humans. It's only us that do that. So he's a human doctor, a psychiatrist, Dr. Jonathan Shea. And he defined it as the psychological consequences of a betrayal of what's right by someone who holds legitimate authority in a high stakes situation.
Okay.
So it's kind of a long definition. And so the really quick simplification is knowing what's right, but not being able to do what's right.
Because you have a higher power telling you what you have to do, your boss
Yes.
or someone, the
And
client,
the real
whatever.
key to it being a situation that meets the moral injury qualification is the betrayal piece. So meaning it's a betrayal of what's right by someone other than myself.
Okay.
So it's not moral injury if I make a bad decision. It's not moral injury if I'm affected by chance. If that makes sense.
Yeah, it makes total sense. So it's about you having a certain value and then someone else asking you to betray that value, and then you follow through on whatever action that is.
That's
and
correct.
Then you have that leftover guilt, or that's why it's considered an injury, right? Because it's something that now you have to repair.
Right.
Okay.
And I first became aware that this was even a thing when I read a book by Dr. Wendy Dean, also a human physician, called If I Betray These Words. And her book is about the struggles of human physicians who were prevented from providing the care they believed in by the systems in which they worked. So they might have been prevented by an insurance company who would deny a particular diagnostic or treatment, or by big hospital corporations that would not allow outside referrals. And so patients couldn't go to the very best specialist. They had to go to the specialist within the system, for example.
Right.
And as I read that book, I realized that I guess I was ignorant to how much that affects human physicians in ways they don't have the same exact restrictions that veterinarians get from owners, but they have different restrictions that are just as difficult to deal with. And so Dr. Dean she talks about it as moral injury. And so it was the first time that I was introduced to the terminology. I immediately saw how it applied to veterinary medicine. And so I started doing quite a bit of research to understand what it is, understand how it's different than burnout and compassion fatigue and post-traumatic stress, and then really wanting to talk about it very widely so that our veterinary team members can understand that this is a thing and kind of what we do about it. I like to give a couple of really big examples that help people also understand moral injury, and ones that are very public, not veterinary related. During Hurricane Katrina in August of 2005 at Memorial Hospital in New Orleans, and there's a book about this called 5 Days at Memorial. Memorial Hospital lost all power because of the flooding.
Remember that, yeah.
In New Orleans. And so they had no ability to evacuate because they were surrounded by water.
Nowhere to go.
They had no supplies coming in. No rescue was coming for them. So they have this hospital full of patients, no air conditioning, limited supplies, and decisions had to be made about who was going to receive care and who was not going to receive care.
Yeah, it was like a live or die. You live and you die kind of
Yeah.
thing. Yeah.
And there are multiple first person accounts in this book. And I think it's actually a series on Apple TV as well, for those who would rather watch a series rather than read a book. But the series is based on the book, where they felt overwhelmed by their lack of ability to do the right thing. And they felt betrayed by leadership at all levels, federal, state, within their hospital. It was a corporate hospital, that no one came to help them.
Right.
And in a surprising crossover to veterinary medicine, there were actually pets sheltered at the hospital because staff members who knew they were going to be there for the hurricane had brought their pets
Brought
to
their
the
pets.
hospital.
Wow.
And then when rescue came, pets were not allowed to be taken onto the rescue boats.
Right.
And so they euthanized pets in the hospital prior to evacuation.
Wow. Which they weren't used to.
They clearly were not used to. And as most veterinarians know, that experience during Katrina of pets not being able to go with rescue changed all of the regulations about pet rescue, which is at least one positive thing that came out of that disaster.
Right.
But so
Right.
that's a huge moral injury that those hospital workers suffered. And then we saw a very similar thing with COVID, right, in 2020, where we did not have enough resources to treat the very, very sick people. And healthcare workers were also forced to ration care and make decisions about who was going to be treated and who was not. So that's moral injury. The other example is in August of 2021, when the United States withdrew from Afghanistan, and we had trusted partners in Afghanistan that US service members had made promises that those trusted partners would be taken care of.
Right.
And those promises were not fulfilled. And those promises had been made. The author of a book, Scott Mann, is an author of a book called Pineapple Express. And the book is about individual service members trying to rescue their partners outside of the government because the
Yeah.
government wasn't doing it. So
Yeah.
those service members, they expressed that that promise was written in blood that they
Yeah, it
had.
was because those people saved their lives in a lot of
Right.
cases. Yeah.
And so that's huge moral injury to those service members who had made a promise, and then they could not control the fact that the promise was not kept.
Right. Yeah,
And
their
so
hands were tied.
that's moral injury. And the term, Dr. Shea, his terminology, or his coining the term, came out of his work with Vietnam veterans who had been forced into actions in military circumstances that they did not agree with.
Oh, yeah. Well, so many because they were drafted back then. So
And
many
so,
people had to go into that war that did not believe in that war whatsoever.
right. So
Hmm.
that's it's really originated as a military experience and
Right.
then has been recognized by most people. There are a few purists who believe that it only should apply to military experiences, but I don't believe that we can isolate an experience to one group of people when the things that qualify it as a moral injury apply to other groups, healthcare workers, first responders, all kinds of different groups of folks.
Yeah, I would imagine when you say first responders, there's a lot of that too. It's like,
Mhm.
do you save the baby or the mother? Do you save the, like,
Right.
there's always those kind of situations where people have to make choices and it's kind of a no-win situation.
Mhm.
Yeah. Yeah, that's heavy. It's heavy
It
stuff.
is. It's a heavy topic, but when I say I look forward to talking about it, I look forward to talking about it because I think it's so important for awareness.
Sure.
But it is a heavy topic to think about how we're exposed to it in the veterinary profession pretty much every day.
Right. And we're expected to kind of just accept it
Mhm.
and move on,
Mhm.
And I think in a lot of ways that it's something that we would like to change, but I don't know that there's any way that you can change it. I think if you say moral injury is a bad thing, like it's going to be part of life, right? Because in Katrina, those people had no choice.
Hmm.
COVID, the healthcare providers had no choice. Like they were given a limited amount of resources and really they didn't know what they were doing at the beginning. One of my friends
Right.
was in that situation. She had COVID during that time and it was just a mess,
Hmm.
and a lot of people died that probably didn't need to.
Yes.
And then the people that were caring for them had to live with that,
Right.
which is tough. Yeah. So tell me how it differs from compassion fatigue, because you said it's different. So
It
let's make
is.
that distinction and then we'll go work through it.
So compassion fatigue is described as the physical, emotional, and psychological impact of exposure to the trauma of others.
So yeah, that makes total sense.
So I see the trauma of a client and have an inability eventually to empathize or feel compassion for them
Right.
because my compassion becomes fatigued, right? I can't generate that level of empathy over and over and over and over and over again.
Right. One more day.
Mm-hmm. And that becomes bad when those experiences start to affect my thoughts, moods, and well-being outside of work. Right?
Right.
So compassion fatigue is about that. So it's about my exposure to the trauma of others. And then burnout is a state of emotional, mental, and physical exhaustion brought on by prolonged or repeated stress.
Yeah.
So that doesn't necessarily have anything to do with morals, right?
Right.
It's prolonged stress.
And it's undefined stress. It could be anything.
Undefined.
It could be at home stress. It could be at work
Absolutely.
stress. It could be just our job has some stress involved. And
Well, and it could be that you're not in the right seat for you, meaning if you're a CSR and you actually really have trouble talking to people, then you're going to get burned out a lot faster than a CSR that really loves to talk to people all day.
sure. Yeah.
Right? So that's burnout, is that prolonged repeated stress. And then post-traumatic stress occurs in people who have witnessed or experienced a traumatic event, and that can result in disturbing thoughts, flashbacks, sadness, anxiety, detachment, things like that. So that is about my own trauma potentially if I have PTS. But
Right.
I could have PTS because I got into a bad car accident,
Right. Which had nothing to
right?
do with you whatsoever. It just happened.
Right. That
Yeah.
just happened. So that's also different than moral injury.
Right. Yeah.
And so I
It's
think it's so important that we understand these definitions, because if I'm burned out and I'm that CSR that really dislikes talking to people all day, then I need to find a different job in the hospital if I want to stay in vet med, or a different job completely. If I'm a veterinarian that's burned out, then maybe I need to decrease my schedule and work fewer hours. Maybe if I'm an ER vet that's burned out, maybe I need to, go do spay neuter work and just do animals and not humans for a while. So burnout is different, and the treatment would be different. But if I have moral injury and my treatment that I choose is to change my schedule, well, I haven't really addressed my moral injury.
right. It's not going to work. Yeah. And in some situations, I imagine if you're experiencing moral injury at the behest of your boss,
Mm-hmm.
that you could get a different boss that aligned more with your values.
Definitely.
That makes sense to me. Okay, so talk a little bit more about that. So you can be morally injured by your corporation, your
Mm-hmm.
bosses, your situation at your work, I assume, and maybe even clients.
Oh, for sure, clients. So the betrayal piece, remember, that's the key part of the definition. It can come from different sources, just like you said. It can come from the owner, hospital leaders, um, systems, right, that
Right.
aren't working. So suspected animal abuse or neglect.
That one's tough.
That one's really hard because I know what's right, which is that this animal not be abused or neglected.
Right.
I may not be able to intervene in a way that I think is really significant. And
Right.
so
Yeah.
I have to send that pet home to a situation that I know is not good. I've certainly seen dogs that I was 100% sure the wounds they were presented for were because of dog fighting. And not like my dogs got into a fight in my kitchen over a
Like
treat, right? But
purposeful,
purposeful
right?
dog fighting for
Fighting.
sport.
Yeah,
That's an ethical issue, but I think most of us end up having to send those pets home with the people that brought them in.
right,
And that's a moral injury. And so that's a betrayal of what's right by that owner. And I had to be somewhat complicit in that situation because I didn't have all the facts, and I'm not going to go sneak into their yard and investigate dog fighting.
and even if you reported them and then nothing happened, you could
Right.
still feel that injury.
Mm-hmm.
Yeah,
Um, Obviously, the one that people jump to most easily is all the financial decisions that are made that prevent us from providing good care.
right,
And so that is in my mind, the betrayal there is this compact that we expect to have with the owner that we're going to work together to take care of this pet. And then the owner ties our hands because of their own real financial issues. So I'm not vilifying the owner. That's
right,
real for them. But the veterinarian and the staff have a separate experience than that owner because we know what's right and we're being prevented from doing what's right by something that's out of our control.
right.
And that doesn't mean that they're bad people,
No,
but I do still get to have feelings and an experience of my own.
not like it.
Mm-hmm. And so that's moral injury. Um, Hospital leadership, right? Like you said, enforcing a policy that you feel is wrong. And you're having to do something, whether that's use a drug that provides more profit to the practice, but is not the drug that you want to use, whether that's making a treatment recommendation that you don't feel like is the most up-to-date treatment recommendation. There's a variety of different things that might be happening in individual workplaces, and this could happen in a privately owned, single owner hospital. It could happen in a corporate setting. It could happen in a government setting,
Right.
depending on one's style of practice.
Well,
So,
because when you have a boss, they have their own set of morals,
yeah,
and it's their hospital. I learned this lesson the hard way, my first veterinary job. They have their own set of morals, you have your own set of morals, and they don't always mesh.
right.
And so then you are put in that situation because you're the subordinate. And if you want to keep your job, you kind of have to do what they like to do or their
Mm-hmm.
morals dictate. And it does, it wears on you.
Absolutely. And then certainly euthanasia decisions that we've all euthanized pets for reasons that maybe we would not have made that decision if it was our own
Right.
pet.
Absolutely. Yeah.
And so those can weigh very heavily on us. It can be behavioral issues, purely financial issues. The owner is moving and they can't have a cat at their new apartment, right? Massive depopulation events that I have not been a part of, but certainly with high path AI and flocks that are being depopulated and things like that.
That's
Like those
heartbreaking.
are very difficult situations for the people that are involved in that. And so we've got, I mean, when you start to think about it, it starts to, you're like, wow, this is really happening all the time.
Yeah.
And just recently, one of the practices that I support called me. I had been at their staff meeting the week before, and I had been talking to them about moral injury. So then the next week, they have a seizing dog presented by an owner who admitted to using illegal drugs. And he felt that the dog had gotten into these drugs, and that's why the dog was seizing. He didn't have finances for any kind of real intervention. But despite that, the staff put in an IV catheter, gave some anti-seizure medications, but it wasn't really controlling the seizures long term. And so the pet needed to go to an emergency clinic and have 24-hour care and have a lot of intervention that was not going to be financially possible.
Right.
And so they suggested to this owner that the right thing to do would be to euthanize this dog because it was just continuing to seize. The man became very agitated to the point that the police were called. So this became a very dramatic situation in this practice.
Right.
And eventually, the man took the pet away, seizing.
Seizing. Yeah.
That is moral injury for that staff because they knew what was right. There were actually two right options. One would be refer the pet for aggressive care to a 24-hour facility.
Right.
The other would be euthanize the pet to stop it suffering.
Just take it home.
So then when it was taken home, which the staff couldn't control, they are left, and you mentioned this, with a tremendous amount of guilt. And I think that's an important thing to talk about, because we're guilty, right? Because we ask ourselves, could I have communicated better with this owner? Could I have convinced him to euthanize the pet? Maybe I should have paid for the pet's treatment. I mean,
That's
I
a
think,
big one, right? That was a big one for me as a
yep,
hospital owner, because I had
yeah,
to kind of pick and choose. Well, maybe
mhm,
we can try to save that one, but
right,
we can't save them all. And you had to kind of pick and choose the ones that you want to
yeah.
invest in. And that one's tough.
And so we're sitting here with with guilt, right? And all these emotions. And we can't just dismiss it. I don't think it's really within our human ability to quickly just say, you know what, Shannon, you don't need to feel guilty about that. We do have that feeling, and I can't pretend that I
It's
don't have
there.
it. One of the things we tend to do in these situations is transfer that emotion, and we tend to client bash
Yes.
and vilify that client,
Yeah, that
because
guy was
that,
a bad guy, or what an
right.
idiot, or that guy
Hmm.
was stupid. Yeah, that happens a lot.
And we do that a lot with the financial piece too, right? Like, I can't believe they won't let us do this treatment or that
Right.
test. Because that feels good in the moment. In the moment, that transfers the feelings off of me and on to the client.
Right.
But that doesn't last. That doesn't hold in reality. And what that also does that is so terrible is it introduces all this negativity into our practices, where now we're vilifying the people that we're actually here to serve.
Right. Right. Well, and it takes away our empathy,
Yes.
because this guy was obviously a druggie. He obviously, maybe he had the money, but he wasn't going to spend it on the dog.
Mm-hmm.
He didn't like his options.
Mm-hmm.
He maybe was terrified of euthanasia. It keeps us from understanding the other human on the other side of this issue,
Mm-hmm.
because some people are morally against euthanasia.
Sure.
And we don't like that because we're not, but it also is a real thing.
It is a real thing. That's right. And so I think in those situations, and you continuing to use this one as an example, we have to evaluate what we did do. Meaning, they did put an IV catheter in this dog. They did give it some medication knowing that they weren't going to get paid,
Right. They tried.
to buy some time to have conversations with this owner, right?
Yeah.
And we have to be aware of what we can realistically control. I can't control other people's finances. I can't control other people's decisions about their pets.
Right.
And what Dr. Shea and then another psychologist, Dr. Brett Litz, really talk about as far as how do we deal with moral injury is that we have to talk about it
Mm.
with people that understand the situation. And I think this is such a great example because this team, because I had talked to them the week before, they had a really great conversation after this pet was taken away about their feelings, not about this guy and the
Right.
choices that he made, because they couldn't control that.
Right.
But they talked about the guilt. They talked about the sadness. They talked about
The
feeling like they
helplessness.
didn't do enough,
Mhm.
helplessness.
Yeah, there's
Exactly.
that helpless feeling when you can't fix something, like, oh,
Hmm.
we can fix seizures. Well, in this case, we couldn't.
Hmm.
It
Not
did.
with like one injection in 30 minutes, right? Like, you
Well,
need
right,
more.
but the
Yeah,
the fact remains that the dog wasn't better.
right,
And so you kind of have that helpless feeling, like, I wish I could have done more.
right.
Yeah.
And so talking about it in community that understands is incredibly important for us, because I have stories, and I'm certain that you have stories, that if
Too
I
many.
told, I always use my mom as an example, right? She has pets and she loves them. She's not a medical person. If I told her some of my moral injury experiences, she would be so upset and sad that I would end up having to comfort her.
You're right.
So
Yeah.
now,
So
am
then you're
I
not
being
getting
helped?
anything. Right. You're not getting anything back. Now you're giving more compassion that you didn't really want to give. Yeah,
Right.
it's
So
true.
I need to talk about these events with you or another veterinarian or a veterinary technician or another staff member, especially if it's something like this seizure dog where the whole practice was basically exposed. I mean, the police were called, right? Like it was a whole thing. So
Right.
we
Those are
have
big,
to
those are
talk
big
about it.
issues in a hospital when that
Exactly.
happens. You never forget those.
No. So we have to talk about that and not just by talking about the client. We have to talk about our own feelings and our own actions. And Dr. Litz talks about the following steps, which are acknowledging the harm done, facilitate dialogue with others about the harm, develop an action plan about things to do, valued people, or even groups to join to, I love this phrase, rebalance the world's goodness relative to badness.
I love that.
I know. And then the fourth thing that he has is identify support and give yourself grace. But acknowledging the harm done, saying, and that's acknowledging that made me angry. That made me sad. That made me say the emotion, right?
Right.
Acknowledge it.
Right.
And then facilitate dialogue. So as a veterinarian, as a leader in a practice, facilitating that dialogue, saying, hey guys, let's gather for a second and talk about what just happened.
Yeah.
How's everybody
Yeah.
feeling?
Right. Well, and then I would imagine you have to take care during that conversation because you're going to have people that see it different ways.
Yep.
Like I've euthanized pets that my team hasn't thought that was the right thing to do.
Mm-hmm.
They're like, well, I would have turned that person away. And I said, I don't like to do that because then I don't know what happens next. Do
Mm-hmm.
they throw the cat out the window? Do they dump it at the Humane Society and somebody else has the problem? Like take, for instance, a cat that's peeing in someone's house and they
Yes.
want it euthanized. I would go through as much as I could to try to help the client. But if they were to the
Mm-hmm.
point where they were like, no, I'm putting this cat to sleep, I would do it.
Yeah.
But I had other doctors that were like, well, I would never do that. And I'm like,
Right.
so that has got to be difficult when you have different values or morals or ethics or whatever you want to call it in the same hospital.
Very much so. And I think that's a huge component of this conversation because when we talk about knowing what's right and not being able to do what's right, sometimes that's really obvious. I think we all
Sure.
would agree that murder is not right. There's
Sure.
some
Right.
like rights and wrongs that are really clear.
Right.
And then you're right, there are cultural differences, there are hospital to hospital differences about what's right. I just this week, a veterinarian friend invited me to her house for dinner, and you and I probably have this difference based on where we both live. So I just walked into her house, and her 5-year-old daughter told me about 20 feet into the house that I needed to take my shoes off.
Oh, yeah. Yeah.
Because I live in the Southeast and we wear our shoes all over the place and bring them in the house. But in a lot of, winter climates and other cultures, shoes come off at the
Mm,
front door. And
right.
so I asked her, where should I put my shoes? And she showed me the appropriate place to put my shoes. Um, but this was like a right or a wrong to some. I mean, this is a silly example, right? But what's right in their house versus no
What's
one
right in your
blinks
house?
an eye in my house when you wear your shoes in.
Right.
Those are different things.
Sure.
And so, to your point, we all are going to have different opinions about some of these issues, euthanasia decisions, I think, especially. And then there are others like the seizing dog. I don't think anyone feels right about how that went down. But then, so I think when we're having that dialogue, someone leading a conversation like that does have to have a degree of emotional intelligence to be
Sure.
able to acknowledge some of our differences of opinion and let people say things as their opinion without it necessarily becoming a debatable topic.
Right. Because at that point, you're not changing it. It's in the
Right.
past. So
Mm-hmm.
there's no upside to creating a situation where now you're judging on top of everything else,
Exactly.
whatever happened or whatever the doctor did in the situation.
Right.
Yeah. Because in that situation with the seizuring dog, I could see if being the hospital owner, that the staff might be upset that you didn't keep the dog.
Do more.
Well,
Mhm.
right. Like, well, we'll keep the dog, we'll hospitalize it, we'll,
Right.
whatever, knowing that wasn't exactly the right thing, but it might have been better than the dog going home. So you
Mhm.
have kind of like degrees of opinions that probably get
Yes.
tossed around when you're facilitating this conversation.
Yes.
Yeah.
But I would also caution about don't be afraid to have these because you're afraid that it's not going to be perfect,
Oh, sure. Yeah.
right? Because I can
More about
see,
getting it out.
yeah, it's more about getting it out, even if that conversation isn't perfect. Having the conversation is just so incredibly important because if we don't have it, then we're just doing a ostrich stick my head in the sand situation and pretending that this wasn't a significant event in my practice.
Right, right. How do you keep from that conversation turning into like a pile-on? If there's one person that made a decision and the rest of the people agree that it was the wrong decision, say, or not conducive to all their moral opinions, how do you keep that from happening? Because it seems like that would be, I mean, you have to have emotional intelligence, obviously,
Mhm.
but how would you stop that if let's say the doctor made a decision and everybody else is piling on and like they disagree?
I think it's the way that these conversations should be structured is more that I am sharing my feelings and emotions, not that we are doing a deep dive about the right or the wrong of the
What
decisions that
happened,
were made.
right? It's just more about feelings.
It's more of me saying, I feel really sad and I feel that I wish we could have done more. And I can't stop thinking about that dog that is now in his car continuing to
Right.
have seizures.
Yeah. And
And so
eventually
then
we'll
you would share your feelings. And so it's not, and so as the leader of that conversation, if we start to get into this back and forth about, well, I think we should have kept it, the leader does need to pull that back and
right,
say, that's not the point of our conversation.
right,
We're really here to talk about how we feel after that situation has occurred.
right, right. And then how we decide to handle those feelings.
Right. And mostly it's about saying it's reasonable that you feel that way.
Sure. Yeah. It's more about understanding
Mm-hmm.
the human emotion involved in these kind of things. Yeah. So tell me the steps again.
Yeah. So acknowledge
Acknowledging
the
the
harm
harm,
done,
right?
facilitate dialogue with others about the harm, and then developing an action plan about, and this is a long one, things to do, valued people or groups to join with the goal of rebalancing the world's goodness relative to badness. And so a thing to do would be if there, and the seizure situation doesn't lend itself to this specifically, but it would be take a deposit prior to an emergency exam so that you don't end up having done a ton of testing and then find out that the owner can't pay and now you're in this moral injury situation,
Right,
right? So
right.
sometimes we might be looking for an intervention like that to prevent us from
Prevent.
being in this situation in the first place. So that would be like a thing to do.
Yeah.
Valued people might be, I've also been involved in a situation at one of the hospitals I support where we had such a significant event happen at this hospital that we brought in a veterinary social worker to have some meetings with the team.
Mm-hmm.
So from a valued
Great.
people situation, that's, hey, we need to look for some external resources to come and stay at the end of the day and gather in the lobby and talk to a professional
Let's
about
process.
this situation.
Right.
Or groups to join and remember that this Dr. Brett Litz, the psychologist, he's with the Veterans Administration. And so this was primarily steps that were written for those groups. And so are there support groups? And this does actually lead to a great group called the Veterinary Hope Foundation. And that is a group that offers free online groups for veterinarians. And if you just Google Veterinary Hope Foundation, they have new groups starting all the time. And it's small groups of veterinarians, and I think it's open to veterinary staff as well, that meet with provided support from trained individuals through Veterinary Hope Foundation to just talk and connect. And so as a group to join for this kind of situation, I would so strongly encourage people to look up the Veterinary Hope Foundation and the amazing work that they're doing.
I love that. Yeah, I think
Then the fourth one is identify support, and that could be either support within a practice, support with another veterinarian, and give yourself grace, because I think we're all really hard on ourselves. Self-talk is a thing that I'm constantly working on because I feel like
we all have negative self-talk.
We all need to, exactly.
That's why we all need coaches and therapists to help us with that. Absolutely.
But that's about giving myself grace, that if I feel like I truly could have communicated better with that seizuring owner, and this was not actually my case, but let's say it was, and I felt like I got agitated and shut down a little bit, and I was disappointed with myself, maybe.
Yeah.
That I need to probably give myself some grace, that I was in an extraordinary situation.
Right.
And I did the best I could in the moment.
Right. Yeah. Yeah. That's always useful to say to yourself. Because it's so easy to Monday morning quarterback and just keep going back and back and back over, what happened and what I could have done differently. And maybe I shouldn't have done this. And like, we do it all the time with our medical cases.
Yes.
I call it shoulda, woulda, coulda.
Oh, right.
And it's just not helpful.
No, it's not helpful at all.
No, other than if you're thinking through it to maybe see a mistake that you would change for the next time.
Yes.
Like maybe I didn't like the way I got upset, and next time I'm going to try to stay calmer. Like if it's in that learning from, something that you think could be done better, but that maybe losing my computer. I don't know what happened. Can you still hear me?
Yeah, I can hear you, but you're a black screen.
You can't see me. I know, it's weird.
Which is okay.
Yeah, that's all right. Okay, well, let's just keep talking. I'll try to see if I can get it back on.
Okay.
It's like my camera decided to blank out all of a sudden. So let's see if I can get it back on.
Yes.
So we have these 4 steps. There was a question I was going to ask you when you were talking about how do you, now that you know what it is, how do you prevent yourself from kind of like scorekeeping with it? And what I mean by that is, okay, we have a tendency to be like, we overuse like stress and burnout sometimes. And because we know it's a thing, or compassion fatigue, and we use it as kind of, I don't want to say excuse, but we kind of use it as a label. So how do we go about over analyzing our moral injury? Does that make sense? Like now that we know it's a thing, can we go back and say like, oh, well, this happened and that happened. And, maybe, I don't know what I'm trying to say. How do you keep it from becoming another thing that you're worried about? Maybe that's what I'm asking.
Okay. Right? I like that narrowing of the question.
I know sometimes I don't really know what I know what I want to ask. I just don't know how to ask it. Plus I'm trying to fix this camera thing, so I'm a little distracted.
At the same time.
But yeah, that's exactly what I want to ask.
Well, as you said earlier, we can't prevent moral injury from occurring in our veterinary practices because I can't control the actions of other people. So all I can control is my reaction to moral injury. And that's where I think knowing that it's a thing is so important, because then I can separate the actions and decisions of another person that betray what I think is right from my own actions that perhaps I was forced into.
Okay.
And that helps me to say, I feel this guilt because of how that situation went down. But if I understand moral injury and I take the time to sit with that discomfort and really categorize it, then I can come to the conclusion that I didn't do anything wrong, or that I did the best that I could
with that situation.
in the moment with the information I had at that time. So I don't think it's something we should fear, because it's part of almost every day as a veterinarian and as a member of a veterinary staff. So I don't think it's something we should fear. But I do think it's something that we understand, and we understand that moral injury is like trying to fit a square peg into a round hole, because you're caught in a situation that doesn't make sense, right? Like, why would anyone take their seizuring dog away?
Right. That doesn't
And,
make any sense, does it?
no. And so our brains really struggle to process, why would anyone do that? That's not the paradigm that my brain wants to sit in, because my brain wants to be in a paradigm where we're going to treat this pet, we're going to take it to the emergency clinic, and we're going to do all kinds of interventional therapies to get
Right.
these
Even if
drugs
it
out of this
costs
pet
like
system.
$50,000, right?
We're going to
We
do all
all
these
think we
things.
would do that if it was our dog, right?
I think we
I've
do.
always said that. I'm like, well, I would.
Yeah. So then we get caught in this emotional whirlpool of, this doesn't make sense to me, to my brain. It feels really bad. I think I should have done something different to make me not feel bad. But then if I know that moral injury is a thing, then I can stop and I can say, I didn't have a lot of choices here. The law allows this man to take his pet away from my hospital.
Right. And
And
it's his
I
dog.
couldn't change that.
Right.
And so even I have all these swirling emotions, if I sit with them for long enough and I talk with the other members of my team, we can express that we're sad. We can express that we feel guilty, but we don't have to permanently grab onto those emotions and hold them forever. We can then let them go.
Yeah. I think that's so important because many of us fear the process of processing feelings.
Mm-hmm.
We're so afraid of that whole process. And that's one of the reasons that I love life coaching so much, is because if you don't understand that, if you don't have the emotional intelligence to be like, okay, it's good to feel sad sometimes. It's
Mm-hmm.
good to feel this about this case. Like this dog, yes, this is sad. This is hard. This is frustrating, or whatever emotion you're feeling around this case with this dog and this druggy guy. It's like, that's okay.
Mm-hmm.
And it's okay to be sad, even if it lasts a day, even if it lasts a week, and
Yes.
it's probably, you're going to go through the stages of grief
Mm-hmm. All
like
the
you do with
things.
everything, and that's okay. And
Yeah.
all of the things that I teach in when as a life coach is to not fear those negative emotions.
Right.
Like, because it's so powerful if you can just acknowledge them and sit with them for a little bit, then you can start to process them rather than letting that control you
Right.
forever. Yeah.
And the client bashing is us using the cheap emotion of anger
Right. In
instead
the
of
in
the
the
more
grieving,
expensive
right?
emotion of sadness.
Yeah. Yeah. And that's part of grief is the
Mm-hmm.
anger.
Mm-hmm.
Yeah. And so realizing that is like, okay, I could get angry at the situation,
Yeah.
but not at the guy. Like,
No,
I'm
because
angry that this happened. Like, why did God give this dog a seizure and let him get into the drugs? Like, you can have that kind of anger, but the anger, like bashing the client, isn't helpful because it just creates more helplessness
right.
because you can't fix it.
Mm-hmm.
Yeah,
And I think the anger is a little more of a flash, right? Versus I think the sadness is what sits.
sure. Well, and that's what can really pull you down if you don't process it.
Right.
That's why it's so important to talk about it and
And I
really
love,
understand it.
yeah. And I love this phrase, a problem shared is a problem halved.
Mm,
Because I think that one of the things that we are all guilty of is, if I'm not sharing my problem with anyone else, then I tend to just amplify it in my own mind, because I don't have any external input that gives me reality.
yeah.
Versus if I
or
share
somebody to
it,
say, it's not that big of a deal, or
exactly.
get over it, or, my dad always says, don't worry about it.
And no one likes to be dismissed like that when you're really you're
When you're
feeling
really
for
upset
whatever
about
reason
something.
that you
Yeah.
want to get sucked into this negative whirlpool. But sometimes it's helpful to have, not sometimes, it's always helpful to have an external voice, whether it's a life coach, whether it's a friend, a family member, a trusted coworker. There's so many options here, depending on the situation, for
Right.
someone to say, I get why you feel that way, but you really did a great job in that
Yeah.
tough spot.
Right. Yeah. There was nothing else you could do.
Hmm.
I love that line. It's like you did everything you could. Because in
Yeah,
that situation, they did do everything they could.
they did.
Like that's a fact. And
Hmm.
I think then the caution comes is to not let it turn into a swirling whirlpool of negativity, because
Yes,
what's going to happen is you start to tell the story over and over and over again,
right.
and it becomes bigger and bigger and harder and harder. And I've seen that happen in veterinary hospitals because
Hmm.
somebody wasn't there that day, and now someone's going to have to tell them what happened yesterday at the
Yes, yes,
hospital, and it's going to get bigger and
right.
more negative.
And what if we focus more on, at least we got an IV catheter in and we tried to give it some Valium and it did stop for a few minutes. And then, what if we, instead of the story highlights being all these negative things,
Right.
what if the story highlights are the things we did do, that we did say, the fact that we spoke afterwards and we were all able to honestly share our emotions and
Right.
how we felt supported by our team after this tough situation.
Right.
So I think it's fascinating when we think about the fact that we have that choice. We can either turn it into this big negative story, or we completely can choose to turn it into something that highlights the good things that we did.
Yeah. Well, and I want to reiterate that, because that's true in everything.
Hmm.
I think we don't always realize that we are completely in control of how we feel
Yes.
every moment. And the first time someone said that to me, I'm like, well, that can't be true. And it absolutely is. It absolutely is. It's about how you're thinking about a situation, how you're acting in that situation is going to dictate how you feel. And in every book you read, every psychology text, the more you investigate that, the more you understand that it's true.
Yes.
And you don't have to feel like this was a horrible, horrible thing that happened that day.
It is a skill that takes time to develop. And some days I'm really good at it, and other days I'm not as good at it.
Right.
But I'm much better now about recognizing when my brain is taking me down a path that
Rabbit hole.
isn't good and doesn't feel good, and recognizing that I do have the ability to change that.
Right.
And now I'm much better, but it's
Yeah.
definitely been a process.
There's so many thoughts that don't serve us.
Right.
Like if I choose to think that this was a horrible thing and I should have done more and this guy's an idiot, and like all of that is not useful. It doesn't do anything for me or my team. And
Right.
so I think sometimes with me, I know it is a process, and some situations are easier than others for everyone. And it's not toxic positivity. Like
Mm-mm.
you're not a Pollyanna, but you can process it and say, okay, here's what went wrong, here's what went right. Let's focus on the rights.
Mm-hmm. The other thing I like to talk about with teams is, when situations like this happen, is what do we want to keep doing and what do we want to start doing
Because of this situation.
because of a situation. Like if we're in a debrief about something that didn't go that well,
Right.
there's a lot of great research about, if we spend a lot of time talking about what went wrong, we're actually strengthening neural pathways towards those things that went wrong.
Yeah, and the negative. Yeah.
Instead of thinking we want to keep putting in IV catheters when seizing animals come in and being ready to give medication once we figure out what that appropriate medication is, right?
Right.
We want to start. I mean, this example isn't a great one for this keep doing and start doing, but you see what I'm saying? Where we're saying
Yeah.
we want to do something differently maybe than what we did before, but the thought process is in that positive direction. What do we want to start doing?
How might it have gone better had we
Mhm.
done X, Y, or Z? Like
Right.
perhaps had we gotten the guy in a room right away, had we gone in with a treatment plan, while you were putting in the IV catheter, perhaps, I don't know how this all went down, but perhaps he wouldn't have gotten so irate.
That, who knows? Right.
Yeah, you don't
So,
know.
but keep
But
doing and start doing, I find really helpful ways to channel conversation because we're not then focusing on what we did wrong. We're more focusing on a change that we want to make to do better next time.
yeah. So let's go back to the example where you're in a situation with somebody that's your boss
Mm-hmm.
that doesn't have their values don't align with yours, because that happens a lot. I talk to a lot of veterinarians that are frustrated with their work, and a lot of times it's about somebody that's above them, and
Mm-hmm.
they feel like they're stuck and they can't do anything. And that was what happened to me in my first job, that my morals didn't align with my boss. And because I was really young and really stupid, I just didn't realize I could just quit. I'm like, well, you can't quit your first job. That would be a fail. That would be failing. And so instead of doing that, I just fought him. Like we were constantly like this, and I couldn't win because he was my boss and it was his
Mm-hmm.
practice. So I got fired. Like that's how I got out of there. And so in hindsight, I was like, well, I should have just quit. Why did I wait for him to fire me over that? Because I wasn't going to change him. But let's talk a little bit about that, because that, I think, is a situation a lot of people are in. I mean, not probably as much as the client situation, but there are a lot of people that disagree with their bosses.
Yeah, I agree. I hear about that some.
Medically or morally, or, it could be anything.
So I would say
Family
first,
values.
is is it something that one, and it depends on the exact situation and some about the how far apart are we?
Right,
But I would say first, is it something that you can let that person do it their way and you can do it your way? And can you work to wall that off and recognize that you're not responsible for that person making decisions that are not the same as yours?
right,
And so some practice environments might allow that, where you've got Dr. A practicing one way and Dr. B practicing another. Not all practice environments are going to allow that, but that's
right.
if everything else is great about that practice and you really do want to stay there because it's 5 minutes from your house and next to your kid's daycare and all of
And
those things,
everything else
right?
is great. The only
Yeah,
problem I have is I don't like the way this doctor practices
right.
medicine.
So can you allow that person to do their thing and recognize that what they're doing does not in reality reflect on what you're doing? So
Right.
that would be one thing if that's how that goes down.
There's like medical differences, like this
Right.
doctor, and that happens a lot, right? Like in my
Hmm.
practice, I was like, hey, practice however you want, as long as it's the right, I might do it different than you do it. As long as everybody's getting well and the clients are happy, that's really all I care about.
Exactly.
Yeah.
Now, if someone is being restricted, you will not use the most updated medications or treatments for whatever reason that one
Right.
is restricted. I truly think you should leave that job because I don't think you're going to win that battle. It's going to be like your situation that you described.
Right. Right.
That
You
you're
just
just
get
going to
fired over it.
constantly be clashing and feel like you're being prevented from doing what's right
Right.
by someone that is in control in a high stakes situation. So you're just going to have moral injury over and over and over again. And so I do think you need to remove yourself from that situation. And veterinarians do tend to think that they're not going to find another job. And yet I don't know that I have ever met a veterinarian that wanted to be employed that was not employed.
Right, right. Yeah. Especially recently, like in the last
Yes,
5 years, there's been a shortage of veterinarians,
you
right? And that
can
kind of
find
goes up
another
and
job.
down. But yeah, even in hard times, you will get another job. It
You will.
absolutely is true.
You will. But it takes a lot of bravery to walk away from a job
Sure.
because we tend to think I'm the one somehow screwing this up or I'm not coping appropriately with my situation because
Right.
we tend to just take all this on ourselves, right? But if you're exposed to moral injury like that every day, you're not going to win probably, and you should leave.
Yeah, it's kind of like self-abuse. It's like just taking it over and over and over again and not doing something about it.
Mm-hmm.
And it's just going to build up and you're just going to get more and more resentful of that person, of that practice.
Right.
Um, yeah, it's a cautionary tale.
It is. And it's not a failure on the part of that veterinarian that leaves. I think that's another place where we get kind of hung up.
Right,
That, again, that guilt of I should have done more. I should have
right,
communicated differently. I should have
right,
sacrificed my own values to assimilate.
right.
It's not a failure to stand up for what you believe in and what you know is right and how you were taught in veterinary school and how you hear your classmates talk about practicing. Like there tends to be a lot of ways that you can validate your feelings.
Right, right. Yeah. And I think even going back to what you talked about, the steps about moral injury is some of those things, depending on the person that's in charge, some of those things could be remedied by a conversation.
Sometimes they
You know,
can.
if you have a reasonable boss. I mean, I didn't, but if you have somebody that's like, "Hey, I get it. I get why what I do is feels like it's harming you in some way.
Hmm.
Can we agree to make this better? Like, is there
That's right.
something that we can both do to get on
Hmm.
the same page so we don't have to have you quit?" And that can sometimes happen rather than I think a lot of us as veterinarians and maybe in our first job or second job because it is such a the boss is usually way more experienced than we are. It's hard to have those conversations
Yeah.
because we think that we're not justified or we don't know enough or we're not smart enough or whatever our brain tells us. But I think having that conversation sometimes is super helpful. I don't know how many veterinarians that worked for me that would come to me and say, well, I want to change the vaccine protocol because AHA just came out with a new one or the feline practitioners and I'd be like, "Oh, really? I was unaware."
Hmm.
So of course we want to follow that. So tell me
Yes.
what it is and let's fix that.
Right.
Or sometimes it's something simple like, I need more time off because I have
Hmm.
children and the person who's your boss doesn't even like really realize it until you
Right.
bring it to their attention and be like, "Look, I'm here 45 hours a week and I just can't handle it. Can we change my schedule?" So I
Hmm.
think giving people the idea that they have some power in some of these situations if they choose to take it. And maybe you'll get fired like I did. I didn't handle it right and I learned a huge lesson from that. And it was really the best thing that ever happened to me in hindsight. So for me, it was a good thing, but you don't have to do it like I did it and get fired, right?
Right.
You can try to fix it, and if it doesn't work, then you can decide to leave.
And you should always try to fix it, right? You should always have that conversation. And I talk to people about a lot of different ways that they can have conversations because we all think that it needs to happen in the hospital, in the office, things like that.
Like
And
in
it
the middle
really
of the
doesn't.
day with the door closed, so
Right.
everybody's
And
outside whispering, wondering what's happening.
so many times that's the worst way to have these conversations. So
Yeah.
I think breakfast meetings are amazing. So you meet at 6:30 a.m. at the IHOP down the street from the practice and you have breakfast. And so it's the beginning of the day, no interruptions. Your first appointment starts at 8. You can easily both get there. So I think breakfast meetings can be really great. Certainly, dinner is also fine. It's harder sometimes to make dinner happen because of all the different things that are happening in our lives. So I honestly think breakfast is great. Certainly, you can meet for a coffee anywhere. And then the other thing that I love are walking meetings.
Mm,
And so that
yes.
is you go to a park or a walking trail near the practice and you just go for a walk. And one of the reasons that walking meetings are amazing is you are not face to face staring at that person. And so if you have
Feels less
some
confrontational.
way less confrontational. So you're
Yeah.
moving your body. So
Right.
it gives a little bit of an outlet to nervous energy that you might have, things like that. You're not face to face staring at them. And it's just a really unique way to have a conversation that often works out much better.
Right. Because both parties would be calmer if they're on a walk.
Hmm.
Right.
So don't think that you're stuck having these difficult conversations in the office or even worse in the break room, right? Where you've closed the door and everybody keeps wanting to come in and get their yogurt.
They're up against the door. I've had that happen. I've opened the door and like three people fall in. And then you're like, how much did you hear? Yeah, that's
So I
always the
think,
danger when you're in the hospital is the walls
mhm,
aren't always as thick or the doors aren't as thick
no,
as they should be. Yeah. So is there anything else we should talk about? I think we've covered a lot.
I think we've done a great job of
I
talking
love
about moral
this. Yeah, I
injury.
love this topic.
Yeah, it's
Yeah.
important.
It's so important. And it's so important to distinguish it from all the other things that we talk about.
Right.
And please, when we say talk about your feelings, please don't go on the internet and pour it
No, no,
out.
no.
I just
Mm-mm.
I just have a real aversion to that because
Yes.
it's so hard because, people will pour out their heart on some social media site and then
Hmm.
you get a lot of support, but then you get these people that will bash you or
Yes.
say you did something wrong and it's like, oh, that's not the way to do it. You know,
No,
talk
it
face to
is.
face with someone, get on, a call with a coach, email me, email
Yeah.
somebody,
And it's
talk with
face
your
to face with the
colleagues.
right person. As I discussed, like my mom is not always going to be the right person.
No, she'll feel sorry for you and
Right.
again, my mom would give me a bowl of soup maybe, or just like, well, or try to change the subject because it's uncomfortable, right?
Hmm.
Yeah, it's like moms are great to, pick you up off the floor when you're not doing well. But in this situation, because they don't have the same experiences,
Right.
but you could talk to a nurse or a doctor or somebody.
Another medical professional, your
Yes.
practice manager is often a really good outlet.
Yeah.
There are a lot of good choices, but completely agree. Online is not the best choice.
Oh, I get
Um,
so frustrated. I don't even know why I'm on any social media sites for veterinarians. I thought it would be good for me to kind of monitor, but I just get upset because so many people suffer needlessly at the hands of their fellow veterinary
I
professionals.
know
Like,
it's
why
bad
is that? Why is everyone so mean right now? I don't
because
get
we
it.
all have to be right.
Yeah, 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 you don't. And in this situation, there is no right.
Mm-mm.
Whatever's right is what happened.
It's
It
hard.
happened. And now we have to deal with the fallout, but
Hmm.
you can't go backwards. And I think that's something really important to realize. It's like, this is the decision I made.
Right.
Maybe I wouldn't make it again because I wouldn't want to
Hmm.
go through these emotions again. However, it's made. Now let me process
Right. With
and
the
let it go
appropriate people in real life.
and give yourself some grace.
Yes, always.
That's so important. I love it. Okay. So I think we've covered the subject well. If anybody out there has a story or they have a
Mhm.
situation or they want to talk about this more, I would really encourage you to email me. My email is jacappeldvm@gmail.com. Email Shannon. She can, work with you as well. But if we get enough people that are interested in this subject again and we want to go through specific stories or situations,
Sure.
would you be willing to get back on?
I would love to.
Okay. So yeah, reach out to me. Send me an email or go to my website and send me a message there. Because I love topics like this that aren't widely talked about yet.
Hmm.
We need to get that information out there.
We do.
So thanks everyone for listening. This is Dr. Shannon Bass. I appreciate you coming back on so much, and I hope we do it again.
Me too.
All right. Have a beautiful week, everyone. Bye.